Now, when we build scenarios, we identify what we call key driving forces. And key driving forces, as I said, are these trends of such incredible importance that in the case of this pandemic, they will be influential in determining who lives and dies, who's impoverished, and who comes out of this in relatively good shape. We've identified 15 of those. As many of you are already working and writing in this field, I don't need to dwell on them, so I will take you through them very quickly. In no particular order, the first one that comes up in our analysis is reaction times from governments and mass testing. And it would seem to be the case that governments that moved really quickly on this thing and tested widely have been able to manage the pandemic far better than those who waited. And we made the example in a document we produced for some corporates that of Taiwan, for example, screening flights out of Wuhan last year already, lessons it had learnt from the 2004 SARS outbreak. And then by contrast, societies that waited relatively longer, the Iranians, the Italians, the EU, the United States now trying to put out a fire. I see Mr. Trump this morning considering clamping down on domestic flights within that country. On impact, we ranked this force, the reaction times and mass testing in order to manage the pandemic, as the third most important driver of how the pandemic was likely to evolve. And on uncertainty, how much did we understand about this force? We ranked it midway through the rankings. Now, I'll here just make one point that I won't repeat later on, that even if something is ranked relatively low down on impact or uncertainty, that does not mean we understand it well, and it does not mean it is unimportant. The 15 trends we've assembled here are all assembled because of their extraordinary importance in determining the evolution of the pandemic, and we understand few of them very well. Second one for us was median age, and again, it was early days, so there's still a lot of data to come in, but it does appear as if younger populations might weather this thing better than older ones. The Italian example, median age 47, against the Chinese example, median age 37 is something to ponder. In South Africa's case, we have one great advantage here in facing the pandemic, that only 35% of people in our country are over the age of 35. But the most vulnerable South Africans by age, older people, are very exposed. We saw that in social grant collections last week, which really was quite counterproductive in seeking to protect older generations from infection. On impact, we ranked it relatively low down, not to say that's unimportant. And on uncertainty, we understand age profiles and demographic trends relatively well. Domestic travel, critically important in order to interrupt the spread of a virus through a society. Congested transport services will greatly hinder, particularly in countries with sophisticated infrastructure, such as South Africa. Efforts to isolate regions and individuals. The Chinese rail networks are being shut down, an example of that. South Africa's taxi industry, a very sophisticated transport system, runs on great infrastructure, but it packs people into close confines with each other. And the extent to which controls on the taxi industry have been relaxed over the past 24 hours will, we think, undermine somewhat attempts at making sure that this 21-day shutdown and the isolation protocol succeed as they might have. On impact, relatively high up, uncertainty towards the bottom third of the uncertainty ranking. Speed of new infections. This is a critical factor. I think this is not contested at all. Most COVID cases are mild, but a percentage of cases become serious and they require hospitalization. And the fear here is this, that if the virus, therefore, is allowed to spread too quickly, there's no sense really anywhere that the spread of the virus can be at a minority share of cases.
Apologies, Dr. Cronje, we lost you at there. No evidence. You were speaking specifically about the spread of the virus.
Thank you, Harman. Yeah, the spread of the virus is there's no evidence that you can prevent the spread of the virus. The consensus view is it will spread across societies, but the critical thing is the speed of that spread. Because if it spreads too quickly, the minority share of cases that are serious overwhelm the ability of healthcare systems to treat the ill and that triggers a humanitarian health crisis. And it's really this a fear that saw the abandonment of Mr. Johnson's thesis in the UK of herd immunity in that country, ranked on impact and then ranked on uncertainty. Patterns of infection, we think this is a key question in determining the trajectory of the pandemic. And there are three hypotheses here. The first, the most frightening one, is of an exponential infection curve. That's the idea that the number of infections could double every 2 to 3 days until 80% of people are infected in the society. Health systems are greatly overwhelmed, and that triggers the humanitarian health crisis. The second hypothesis is what China might try to get the world to believe it has achieved, which is there's an initial spike in infections and then draconian isolation efforts are introduced, and that depresses the viral load in a society to a very low level, and that the viral load will remain at that low level, even effectively extinguishing the virus. Obviously, it's still present and will remain so until a vaccine is available. But the society, after its initial push at isolation, will be able to continue somewhat normally after that. Then there's a third hypothesis, and this is the one of multiple peaks and troughs of infection, and what the waves of second and third waves. And what this hypothesis holds is that there'll be an initial spike, and then isolation efforts will help to flatten that curve. Whereafter, instead of maintaining a low viral load for very many months, there'll be future waves of infection. We think this is likely the probable pattern for South Africa. And be aware there that those spikes will not be national spikes. They'll be regional spikes, and they will be sectoral spikes. And they will require what we later call a firefighting approach to deal with the crisis, where isolation efforts, shutdown efforts might become more regional, localized, and focused on specific sectors, ranked again on impact and uncertainty. Then there's the question of population density, quite obvious, the implications of this. Consider that over 2 million South African households, or think of them as families is better, live in shack settlements. That's out of a total number of in the region of 15 million families in the country. And we think that is true, the bullet point you see there. Population density may turn out to be inversely proportional to the success of isolation efforts. And we've ranked those again on impact, and we've ranked them on uncertainty. Then isolation efforts themselves. We're pretty clear on this, I think, and I think the global position is too, that isolation is the most effective means to prevent a humanitarian health catastrophe as it flattens that curve. And here you can rely on voluntary measures, social pressure. Social media might be very important here, frowning upon institutions that cram people together, or people who travel around extensively, exposing others to infection. And then there can be involuntary measures, such as those now introduced in South Africa. And those do run the risk of serious civil rights abuses, and we are concerned about some of the behavior we've seen out of the Defence Force and out of the police. Not a new concern that for the IRR, it's a long-running concern. And I think that greater policy attention and scrutiny and activist effort needs to be focused upon, ranked on impact and uncertainty. Then international travel. Obviously, the ability and willingness to interrupt international travel networks will greatly facilitate clamping down on a flattening of a curve in a particular jurisdiction. Is the question here, did South Africa move a little bit late on this, considering the extent to which infections were imported? That will later be asked. On impact, we've ranked that. On uncertainty, we've ranked it. Temperature and changing seasons. Now, this may turn out to be really important, both for the world in the immediate weeks ahead and for South Africa in particularly about 6 months down the line. The research, again, is not entirely conclusive, but there is evidence to suggest that this virus does not like warmer climates. Now, much of the world infections in January already, Singapore, Thailand, Argentina, countries that have that have not. Yeah.
I do apologize. We lost you at much of the world. You were about to, I think, explain the climatological considerations in much of the world.
Yeah, I think let me go back to that sort of. The point I'm making is this: is that much of the Northern Hemisphere is now moving into its relative summer. And this might turn out to be very important in helping those societies flatten their curves. And then they could take some solace perhaps from the sort of Australian, Singapore, Thailand, Argentinian examples, countries that have problems but have not developed the types of crises that we saw around Milan and northern parts of Italy. And we can quite sustain the argument, and it's only that now, that as the effects of isolation in Northern Hemisphere countries coincide with the vast quantums of stimulus introduced into their economies, and as they move into their summers, you can begin to see outcomes where much of the world pulls out of the crisis of the pandemic, and not the pandemic and the broader problem itself, but the dire crises that the pandemic might pose sooner than is feared. South Africa, however, is moving into its winter. And if being a country of relatively young people, the point I made earlier, is very much in our favor, I think moving into winter is not. The 10-day weather forecast for much of the sort of high-filled regions of the country now suggests evening and nighttime temperatures slipping into the mid and even low teens, and we've ranked that again on impact and on uncertainty. Then there's the question of monetary and fiscal policy, and we'll make a particular point on South Africa here. It's exceptional, extraordinary how much money has been poured into markets by wealthy economies, rivaling figures that were poured into those economies in the aftermath of the financial crisis. And in parallel with that, central banks have cut rates now, European, American central bank rates to extremely low levels. Here, South Africa has a particular problem because it entered the COVID crisis in very weak shape. Growth forecast ahead of COVID at about a fifth of emerging market norms. The minister in his budget speech in February, a deficit of negative 6.8% against the forecast Treasury growth rate of 0.9. Now that's catastrophic in and of itself before you introduce COVID. Government debt levels have doubled over the past decade. Unemployment has been rising, and the official rate at around 29% is a multiple of emerging market norms. Contrast this to how South Africa entered the financial crisis in 2008. In that era, it entered it on the back of 4 years of economic growth that was on average higher than 5%. It was running a budget surplus, amazing to think, and its debt levels had been cut in half by the ruling African National Congress. It does not have, partly because of the populist policies of much of the preceding period up to COVID, South Africa does not have the stimulus or rescue package capacity to mitigate the economic fallout of shutdown to the same extent as is the case for much of Asia, Europe and North America. And we think this is going to become critical, because I'll later make the point that isolation and shutdown efforts are probably only sustainable if the economic damage they cause can be mitigated to a great extent. And South Africa does not have the capacity to do that, and that raises for us a primary question about whether isolation will succeed and shutdown will succeed here, and failing which, you open the way to these horrible possibilities of the exponential infection curve. On the question of markets, stock markets around the world have experienced a considerable sell-off. My colleagues and I think I probably speak for most of them, have always been deeply skeptical of stimulus efforts since after the financial crisis. And I think in markets surrendering initially around 30%, you saw a lot of that stimulus money washing out of markets. But is this a correction? Have markets in fact found a floor, as many advisors would have their clients believe now on the back of the sell-off, or is there something else? Is there, in the global scenario set that we initially developed, there's definitely an outcome globally out of COVID, where it is to the world what the 1929 stock market crash was to the depression of the 1930s. South Africa, given the weak state in which of entering a long-term recession.
Dr.
ranked on
Cronje,
impact.
I think if you could just pick up from South Africa entering this crisis in a weak state, we just lost you as you were speaking about the 1930s depression.
Yeah, no, the point I'd made, Herman, thank you for that, is that, does this thing turn out on the global scale to be the 1929 crash and what that was to what would happen in the 1930s? Regardless of the global question, and regardless of that, South Africa, given the weak state in which it's entered this crisis, looks assured it will trigger probably a long-term recession here, and I'll share some of our estimates and numbers in a moment. Public compliance, I think this is another question on which we've thought especially hard. Short of an authoritarian response, much of the government's sort of policy edict on isolation requires the public support. And the question then arises, what if the public will not comply with those edicts? And here far too little, I think, has been written on the psychological effects of prolonged isolation, particularly when those are matched with what we call here the imminence of growing impoverishment of literally millions of people. And I think the political leadership of the country has had an easy ride over the past week or so because of the political assurance that don't worry is I think how it's carried into the public domain. We know that your job's on the line, we know that your business is on the line, but we have a plan for that. When it emerges, I think as it will, that in fact those plans are not sufficient to wholly mitigate the loss of income that so many institutions and individuals now face, matched with that psychology of isolation, I think it will be very difficult. It will become a profound challenge to maintain isolation protocols here over the long term. Failure to comply then obviously jeopardizes containment of the virus, but worse than that, it could lead to considerable social disorder. And we flag this as a key risk, particularly if our fears of heavy-handed security force action continue, ranked on impact and uncertainty. Then the ability to work through the pandemic becomes. We conclude in our thinking that the sustainability of isolation strategy will probably in the long term depend on a labour force's ability to work from home or under conditions of relative isolation. We support the idea of isolation completely, but if that comes at the price of economic collapse, then isolation protocols will themselves fail, setting up the curve escalation and healthcare crisis that those efforts are seeking to avoid. And we've disagreed with the comment where it has been made that, look, this is a healthcare crisis, so put the economic concerns aside. We think they're very much the same concerns, and they need to be addressed collectively. Primary, secondary, tertiary sectors, of course, affected very differently, further exposing the most vulnerable people in our society to the effects of an economic contraction. And advice, and my colleagues will say it later too, is that as much economic activity as possible must be encouraged to continue under relative isolation protocols. And I think this has been a flaw in the South African government's approach to shutdown, which has sought to draw a distinction between essential services and others. That distinction really doesn't apply in any economy. And what the distinction should rather be is the question of, can you proceed with your economic activity within isolation protocols to such an extent that you do not pose a serious risk to public health. If that is the case, then such activity needs to be encouraged and needs to continue, ranked on impact and uncertainty. A vaccine is important. Obviously, it's important. And why is it important? It's important because if seasonal changes are not sufficient to greatly undermine the passage of the virus through a society, and if mutations to the virus don't occur that make it less virulent, we'll make a comment on this later, and if herd immunity theories fail, then the only way left to stop the virus is through the development of a vaccine. This will occur. We're fairly confident. How long will it take? 18 months, possibly shorter. It has $1 billion behind it now. Completed, and the many others heroic efforts are being undertaken to ensure that this will occur. It is an important measure, the vaccine, in the sense that the time it takes for it to enter societies, the vaccine, will determine the maximum duration of the viral crisis, and therefore we ranked it very highly on impact, on uncertainty. We're fairly certain there will be one. A mutation, we speak to people, experts in these things, and the viruses apparently are able to mutate. They can become more virulent, and that risk must be flagged. We can be grateful on this virus, as a serious a threat to human health as it is, that it is not more virulent, and it seems to, the evidence suggests, spare children to a relative extent. And again, that is something to be grateful for. Far more dangerous pathogens and viruses, plagues and the like, have sort of marked as milestones in human history. Or could the potency of the virus diminish? That's a question that was asked in the scenarios, and therefore help us get out of this crisis sooner than we'd feared. Far too early to model this effectively, so we raise it as an issue. On impact, a very high, on uncertain, on impact relatively low. On uncertainty, look how highly we rank that, given what its effects may be. Allow me now to just stand back from what I've taken you through and show you the collective rankings on one graphic. Starting with the, let me find my laser pointer for you, and there I can show you. These are our rankings on impact that I've taken you through now. The factor, the force, the driving force of greatest impact on the evolution of the virus, the development of the vaccine, given that it delineates the end point of the COVID-19 viral crisis. Thereafter, public compliance, because if the public cannot comply with isolation protocols, then they break down, and then you risk that exponential curve crisis. Reaction times from governments are ranked third, and of course we ranked it below on impact public compliance, because the question is, will the public comply with whatever edicts emerge from those reaction times, and the subsequent 12 factors ranked below them. And I reiterate, which I said I would not, that just because something is relatively low down these rankings does not mean it is an unimportant factor. It is literally a life and death factor now. Then we rank things on uncertainty to try and understand what are the things that we know the least about. And public compliance for us came out as our top uncertainty. We just don't know if it's sustainable. And this came out on the global set that we started with. We ranked it that highly. In South Africa's case, given the imminence of impoverishment of so many people, densely packed poor communities, security force action, we were even more uncertain. Mutation second, isolation efforts third, relative to public compliance, of course, and mutations, given the influence that both those factors would have on the success of isolation. Fiscal and monetary responses and the subsequent factors ranked beneath those.